Hey everybody, David here with Med School Bootcamp. Welcome to our nephrology unit. This is going to be a massive unit. We're really going to start with the basics here and build our way up. A very commonly tested pathology on the board exams, and the reason is because nephrology and the kidneys, it really goes in with other systems as well. When we think about the physiology and we think about how they integrate with the cardiovascular system or the pulmonary system, it's really important we understand this integration so that we're able to answer questions correct on test day. So in this chapter, we're going to start with some of the basics. We're going to talk about the basic embryology of kidney development. We're going to talk about some of the anatomy, and we're going to build progressively throughout the chapter, talking about the physiology, the pathology, and ultimately the pharmacology. So if you all are ready, then off we go. So in this first video, we're just going to talk briefly about kidney development and the embryology. So the key structure that we need to know here is the intermediate mesoderm. And the reason is because the intermediate mesoderm is what ultimately develops into these other structures. The pronephros, which is the first one that we'll talk about, along with the mesonephros and the metanephros. And so the pronephros, really all you need to know is that this is approximately formed around 3 to 4 weeks, and it ultimately degenerates to become a secondary structure known as the mesonephros. The mesonephros develops approximately 4 weeks because it's coming from the development of the pronephros, and this acts as the kidney for the first trimester of development. But keep in mind, this mesonephros is not around for very long, so it starts to develop some of the things we recognize as being structures in the kidney, such as Bowman's capsule, but it's only there for approximately a week. The key thing I want you to know here is that in males, some of these structures persist as the Wolffian duct. This is sometimes also called the mesonephric duct, relating to its name, the mesonephros. And the reason this is important is because it forms the internal male sex organs, including the ductus deferens, the epididymis, but not the prostate. And this is important. You can imagine this makes for a tricky test question. They talk about, what does the Wolffian duct form? Prostate is one of the answers, and that's not the correct answer because the prostate actually forms from a different structure called the urogenital sinus. And so now, after this structure actually degenerates in approximately week 5, we have the metanephros. This is formed at approximately 5 weeks, and this is the permanent kidney. This is what we think about when we say kidney development, right? We have all of our main structures over here. We have the renal cortex, we have the renal medulla, we have the pyramids, the papilla, the renal pelvis, and the ureter. All of these structures we'll elaborate on in the anatomy video itself, but this is what we think of as the kidney. But it's important to keep in mind that this actually is the final stage of the kidney. It's gone through a whole developmental process at this point, where it's gone from the pronephros to the mesonephros. Now we're at the metanephros. Now we have arrived, and we actually have a functioning, normal appearing kidney. Now, key things I want you to keep in mind here is that the process of our kidney formation is not actually completed until 36 weeks. So although we see this structure at approximately 5 weeks, there's much more development to go throughout the process. We also want to keep in mind a couple key structures, one of which is the ureteric bud, also sometimes called the metanephric diverticulum. And this structure actually develops the collecting duct, the renal calyces, the renal pelvis, and the ureter. This structure is really important because if we have a developmental failure of it, we can get a pathology called renal agenesis, or lack of kidney formation. So the kidney does not actually develop if there's an inappropriate interaction between this structure. So the kidney does not actually form if there's a developmental failure of this structure. Now, another key one we want to know is the metanephric blastema, also referred to as the metanephric mesenchyme. This develops structures like the glomerulus, the PCT, which is the proximal convoluted tubule, the loop of Henle, or the distal convoluted tubule, but keep in mind it does not develop the collecting duct. Again, a little bit of a nitpicky thing in a way that they can trick students on test day. Now, the reason this is so important is because an abnormal interaction with the ureteric bud, the structure we previously talked about, can actually lead to something called multicystic dysplastic kidney. And this is another type of renal pathology in which we have renal dysplasia or poor development of the kidneys. They get a bunch of cysts and they don't function as well as they would in a normal healthy individual. So important structures to keep in mind. And finally, the last one I'm going to talk about here include the UPJ or ureteropelvic junction. This is probably the most high yield one that we're going to talk about in this particular video, the most common one they're actually going to ask about. And the reason is because this is the final structure to cannulize, and failure to do so leads to an obstruction or hydronephrosis. So when we talk about this, we're talking about the ureters, right? So normally we have the ureters that are patent. They're open, right? Urine can flow through freely. But if these structures do not open, they don't cannulize, we get something like this where they're obstructed, they're blocked. And what's going to happen? Well, fluid now is not going to be able to get through that structure. So if you draw your attention up here to our actual kidney anatomy, imagine that this structure right here in the ureter is blocked. It doesn't open, right? It doesn't cannulize. It doesn't become patent during the development. It's a developmental process. Well, what's going to happen? Well, our urine is going to build up and be produced in the kidney itself, and then when it tries to leave the structure, there's going to be a blockage. It's going to have nowhere to go. And this obstruction is going to lead to an enlarged kidney, or hydronephrosis. And then we're going to get a backup of this fluid. Kidney is going to get really enlarged, and now we have hydronephrosis. We can see that on ultrasound. Patient will also complain of certain symptoms. So that's why this structure is so important, because if it does not open up, if the ureters do not open up, we can't allow urine to pass through there, and now we have a blockage in the developmental process itself. Another thing that's important to know is this usually only affects one of the kidneys, and so patients might present with a later onset of symptoms because one of the kidneys is allowing urine production, it's allowing it to go into the bladder, and they are actually having a urinary process take place. But on the other side, we're getting this continuous buildup of back pressure due to the obstruction, leading to hydronephrosis. This is important because we'll talk about some other pathologies in upcoming videos where we have bilateral problems and that neither kidney is allowing urine to pass through into the bladder, and this can create a large problem as well. Now, finally, it's important to know this increases the risk of kidney stones and urinary tract infections. And so the reason that we can see an increased risk of kidney stones or urinary tract infections is because urine production and urine flow through the kidney and the ureter is actually protective against these things. So typically urine is actually produced in the kidneys itself. It then goes into the ureter, down to the bladder, and then is excreted from the body. This process by which there's constant forward flow of fluid from the kidney to the ureter down to the bladder actually flushes the system out. If we have an obstruction, right, and we get a backup, right, we have a blockage here, we're not able to actually get urine going through here, it gets backed up into the kidney, which can create an enlarged kidney called hydronephrosis. This obstructing process allows for bacteria to actually ascend into the urinary system itself. It ascends through the urethra, giving us an increased risk of urinary tract infections. So again, bacteria can actually get into the urethra itself, it can get into the bladder portion right here, and then make its way up the ureter itself because it doesn't have any of those protective mechanisms we usually do, where we're typically flushing them out with urine going the opposite direction. So that's the increased risk there. The increased risk of stones is kind of a similar idea. We typically have adequate hydration, we're typically continuously flushing solutes, but if we have an obstruction and we have solutes that are actually building up in the kidneys itself, this can create an environment that allows substrates to bind together, creating kidney stones, also called nephrolithiasis. So these are really important things to keep in mind because there are common test questions they might ask you about in relation to embryology. So a potential renal embryology question they might ask you about on test day includes something along the lines of a newborn baby who is having decreased urine output production from what would be expected of a normal healthy newborn baby. The parents deny receiving any health care during the pregnancy or any known family history of kidney abnormalities. You decide to get an ultrasound and you see that the left side of the patient's kidney is actually very enlarged. The question then asks you which of the following embryologic structures most likely played a role in this patient's unilateral hydronephrosis. It gives you several options and you go down the list and you see things like the metanephric blastoma being offered, the metanephric diverticulum, and then you see the UPJ or uretero-pelvic junction. And you know that this is the correct answer here because one, this is most likely to affect only one kidney. It's very likely to present as hydronephrosis where the kidney gets enlarged because there's an obstruction in the ureter, and the reason there's an obstruction is because the ureter actually fails to cannulize. This is the final structure to open and it is the most common site of obstruction in a newborn patient. So just a quick summary of this video. Overall, renal embryology is fairly low yield, but we want to start with just a quick basics of kind of setting the framework from the developmental stage. 3 key stages they want you to know about this developmental process. That's the pronephros, mesonephros, and the metanephros. Really focus your attention on the metanephros because those are things where abnormal development can lead to problems. If we have an abnormally developing ureteric bud that fails to develop, we can get renal agenesis. If we have an abnormal interaction between the ureteric bud and a metanephric blastoma, we can get something called multicystic dysplastic kidney. And finally, if we have a problem with the UPJ or uretero-pelvic junction, we can get lack of cannulization or an obstruction leading to hydronephrosis in the kidney. Usually only affects one side and increases the risk for UTIs and urinary kidney stones.